Hey lovely people, it's your girl Nurse Diaries and welcome back to my YouTube channel. So if you're new to this channel, I just want to say a massive welcome. So I'm Nurse Diaries and my channel is literally all about me explaining my nursing journey. So I started when I was a nursing student and I've been posting content just about my nursing journey until now, and I'm currently almost 2 years into being a qualified nurse. So yeah, the channel just is about my journey, tips, advice, and lifestyle as well, because I like to show you guys that I don't only speak and do things about nursing, but I also do like daily vlogs of what I've done in the week. And yeah, just post content. When I go on holiday, I post content as well, so you guys can get to know me alongside the fact that I'm also a nurse. So this video is going to be all about Sbar. So I'm probably thinking a lot of you may have heard of Sbar, some of you may be confident and know what it is, and others have absolutely no idea what I'm talking about, and that is absolutely fine. So this video is just going to explain all of that for you, so that by the end of the video you'll be able to fully understand what it means by doing an Sbar assessment. So first of all, what is Sbar? So Sbar is an acronym that stands for situation, background, assessment and recommendation. 4 letters. Sbar. So situation, background, assessment and recommendation. So when do we decide to do Sbar? So Sbar is usually used when we liaise with other healthcare professionals. So for example, when you're handing over or you're escalating a concern to a senior person, for example a doctor or somebody from the critical care outreach team, or even like anybody from the multidisciplinary team, when you're trying to explain information about a patient basically. So I'm going to use a scenario in this video just so you guys can have a better understanding of what Sbar is and how to actually complete an Sbar. So this video is actually very interesting and very helpful if you are also a student who may have an OSCE coming up, or if you also are just trying to get comfortable with using the Sbar approach when liaising with another healthcare professional, or you might be a nurse who just wants to brushing up on those skills as well. So in this example, we are going to, as I'm a gynecology nurse, I'm going to use a gynecology case study. So this is nothing real. This is something that I'm literally making up right now as I'm speaking to you guys, just so you guys can have a better understanding as to what I mean by Sbar. So let's say we have a lady who's 30 years old. Let's call her Dolly. Dolly is 30 years old and Dolly last had her menstrual periods 2 weeks ago. However, Dolly has appeared in the A&E department due to having extremely heavy bleeding, PV bleeding, which is unknown. Dolly does not have any past medical history. However, Dolly is appearing with menstrual bleeding, a massive clots, and she also had an episode of vasovagal as well whilst being in the A&E department. That is called S. So what we've done right now is we've spoken about the S section, which is the situation. How do we take this approach? So having learned all this information about Dolly, when we've taken handover from somebody in A&E, we've now gone, Dolly's now arrived on the ward, and we're now going to do all of our assessments. So we've covered SMB because we've learned about the situation and we've talked about the background, Dolly's background. We've spoken about the fact when she last had her menstrual periods, and she said that we were told that she has no medical history or anything like that. Cool. So Dolly's arrived and we're going to do our assessments for her. So we check her observations when she comes onto the ward, and she's now saturating at 96% on room air. She doesn't appear out of breath. However, she's a bit tachycardic, a heart rate of 130. So we now decide to do an ECG. Dolly is bleeding heavy, so we're also monitoring how often, how frequently she's using her pads. So Dolly, whilst being with us for 30 minutes now, she has used 2 pads. So we know that the bleeding is quite heavy. It is heavy because she's gone through 2 pads within the past 30 minutes of just being on the ward. And there has been large clots as well. we've taken an FBC, we've sent it to the lab as very, very urgent. We've called the lab up and the hemoglobin came as 60. So with that being said, and with us doing all of our assessments, we now call the doctor. So we've covered the S, so the situation, we know the situation, we know Dolly's background history, and A is for assessments. We've done our assessments, we've done observations, we've done our blood tests, we have assessed Dolly, and now we're calling to escalate, because obviously this is somebody who's clearly unwell, so we're escalating our concerns. So we call the doctor. Having done all of this, we've also looked at the drug chart to see what medication we can give her. If Dolly needs some tranexamic acid due to bleeding very heavy, just to help stop the bleeding, or if she needs some oxytocin as well. So we're calling just for all of that. So we call the doctor. Hi doctor, so we're looking after Dolly. Dolly was admitted from A&E. She came in due to heavy PV bleeding and blood clots. Whilst being on the ward, Dolly has used 2 pads within the last 30 minutes. Dolly has no past medical history. Last had her menstrual cycle 2 weeks ago. Whilst being on the ward, we have checked her observations. She's tachycardic, therefore we have done an ECG and uploaded it for you. Dolly has not complained of any chest pain, however she does have a high heart rate. Dolly did actually experience 1 episode of vasovagal whilst being in A&E, therefore an FBC was taken and her hemoglobin is 60. And she has no medication prescribed on her drug chart. You can, if you know your medication, if you know what to do, you can ask for them to prescribe things such as tranexamic acid to help stop the bleeding or oxytocin. But we for your recommendation part, that's where that comes in. Or you could ask them, is there anything you would like me to do? In this situation, they most likely will ask you to transfuse 1 unit of blood or 2 units of blood and see how things get. And they would probably prescribe the tranexamic acid prior to obviously you doing blood transfusion. But this is just an example. So the recommendation part is more of you asking what is it that you want me to do for the patient whilst you come up to assess the patient. If they need to be assessed immediately, you'll say, I would really like for you to come and assess this patient, and please let me know if there's anything that you'd like to me. I would really like you to come and assess this patient. Is there anything that you'd like me to do whilst you are coming up to the ward? This is important just so that we can actually get things moving. If you know that someone's heart rate is high, just do that ECG before calling, because the recommendation will be doing ECG. So why not just do it so that the patient gets help as quick as possible and as soon as possible. Is really, really important. I hope that you guys have actually learned from this. So Sbar is literally just about you understanding the situation, understanding why your patient is admitted to hospital, understanding their medical history, and it covers the background information. So situation is literally why are they here, what is going on. Background is understanding their medical history. If Dolly had a medical history that affects what we're doing, is she allergic to anything, all of that needs to be asked. Just so that you have an understanding as to what you can and cannot give, what you can do, and any implications that occur. And assessment is what you do as a nurse. What are you doing? How are you assessing the patient? What have you done for the patient? And recommendation is when you have done all of the following above, you are calling on the phone, asking for advice, if there's anything the doctor wants you to do for the patient, or recommending for the patient if you know. For example, my specialty is gynecology. If you know anything that can be used to stop bleeding, like what do the doctors recommend you to do in that situation prior to them coming to assess this patient? So I hope you guys have enjoyed this video. If you want to see more about stuff like this, let me know in the description box. And see you in another video next week, next Sunday. But yeah, thank you so much for tuning in, and yeah, This is something a bit different to what I usually do, but I just thought it would be really interesting for you guys to, as people are starting a new academic year, or as we're getting new nurses, for you guys to really understand how to complete an Sbar approach. So yeah, hope you enjoyed this video. Make sure you subscribe to this channel. September is really fun. I've got so many things coming up, so just keep watching. And we're going to be having something called Talks with Nurse Diaries very soon as well, which will be so fun. And I'll be joined by other ladies as well, guest speakers, so keep a lookout for that. But yeah, subscribe to this channel, share with friends, and thank you so much for watching. So subscribe to this channel and thank you so much for watching. See you next week in another video. Bye guys.